Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking about cumulative effects of the sun on your skin and skin cancer. And joining us for this very important discussion is board-certified dermatologist Dr. John Pelachyk. Dr. Pelachyk, welcome back to Today's Health.
Thank you. It's good to be here again, Barb.
How common is skin cancer?
Skin cancer is extremely common. In fact, it is the most common type of cancer in the United States. Over 2 million cases of basal and squamous cell cancers are treated every year. More serious cancer, malignant melanoma, there's about 68,000 cases that are diagnosed yearly, so it is a very, very common type of skin cancer that we see.
Do you know what causes skin cancer?
Well, there are several factors, but one of the main factors is exposure to ultraviolet light, and this is exposure to sunlight, and there are other sources as well, tanning booths, sometimes lights in buildings and so forth, but that is probably one of the primary cause of skin cancer is the exposure to ultraviolet light.
Does a tanning booth risk you more for skin cancer or the same?
Absolutely, they're definitely tanning booths definitely increase the risk of skin cancer. So we obviously recommend that people should not be using them. The type of ultraviolet light that's found in most tanning booths these days is ultraviolet A light, and this type of light does penetrate into the skin and can cause damage to the skin cells, which could eventually lead to skin cancer.
So it's pretty much a myth that if you just go to the tanning booth, it's not as bad for you as the sun.
Exactly. There was the myth of the pre-tan and exposure before summer, before going to a sunnier climate like Florida. Mm-hmm. That is absolutely not the route to go. It definitely can cause damage to your skin, and there are other ways to protect your skin, which we'll talk about later, that are much safer.
And is damage to your skin cumulative over the years?
Yes, it is, Barb. And that's a very important point because it starts really from the day we're born. All the sunlight that we receive in our skin is the damage is cumulative. It adds up from year to year. So those of us who are a little older, in the days when we were in our youth, we didn't have sunscreens. We didn't really know to protect ourselves. In fact, you remember the old copper tone tans and iodine and going out and getting tans. Everybody thought this was healthy. Well, in retrospect, we know that it's not. But all this damage adds up, so as time goes on, the changes that occur in the skin can lead to precancerous and cancerous conditions. I have patients who ask me all the time, well, I'm using sunscreen now, how come I'm still getting these precancers and cancers? Well, that's because for many, many years prior to the beginning of using the sunscreens, they had not used them, and that damage occurred and unfortunately can't be reversed.
And many of us grew up in the years, and I think it's still probably a myth now that tans are healthy, that if you see a tan person, it's a healthy person. And is it more true that tan skin is unhealthy skin?
Yes, when the skin tans, the tanning of skin is a response of the skin to ultraviolet damage. The pigment cells are stimulated to produce the pigment to try to block the light out from getting into the deeper layers of the skin, because that's where the changes of the cells, the skin cancer occur. So when you see a tan, it's actually a response, a protective response, not a healthy response.
All right, well, let's talk a little bit about skin cancer then. Is there more than one type?
Yes, there are several types of skin cancer. The most common types of skin cancer are basal cell skin cancer, squamous cell skin cancer, and malignant melanoma. There is a fourth type of cancer that we see. It's much less common. It's called neuroendocrine cancer or Merkel cell cancer. We probably won't spend much time on that one, but it is the fourth type of skin cancer that we see.
Well, let's talk a little bit then about basal cell and squamous cell cancer. What part of the skin does it affect?
Well, the basal cell cancer starts in the bottom layer of the upper layer of the skin. This is the top layer of the skin is called the epidermis. The second layer is called the dermis. So basal cell cancers begin from this very bottom layer of the upper layer. This is called the epidermis, and these cells are called basal cells. So when the sun damages these cells, that's where basal cell cancer begins.
And how, if we're thinking about our skin, how thick, how far down is this actually in our skin?
Well, one thing we can talk about briefly is that in ultraviolet light, there are two two major types of ultraviolet light that we see. Ultraviolet A, we talked about in the tanning boost, and ultraviolet B. Ultraviolet A light tends to penetrate deeper into the skin in this level here, but when it passes through these cells, this is where the changes can occur that lead to cancer. Ultraviolet B light does not penetrate quite as deep. It's in this area here. The ultraviolet B light is the type that tends to burn us more quickly, whereas the ultraviolet A light is slower to burn. That's why most tanning boosts use that. But both of these types of light can significantly lead to the formation of skin cancer.
Now this is basal cell.
This is basal cell skin cancer.
How about squamous cell?
Squamous cell skin cancer begins from the squamous layer of the skin. This is a flat layer of cells that extends above the basal cells, or the lower epidermal cells, to the top of the skin. So when the sunlight penetrates through, it causes changes in these cells that can lead to precancerous and cancerous lesions. And in this case, if the cells change here, it becomes a squamous cell skin cancer.
Then what would be your symptoms if you had one of these types of cancer?
Well, let's look at some of the clinical pictures here. Typically, basal cell carcinoma presents as a round, raised, kind of pearly, waxy nodule. Oftentimes, if you look closely, you'll see little tiny blood vessels on them. They're called telangiectasia. Sometimes there's a little pigmentation on them, and they often have, it can either be flesh-colored or red-colored. Squamous cell carcinoma, on the other hand, most often presents as kind of a red, rough plaque where you might have some scaling. If you feel it with your fingers, it's very rough. Oftentimes there may be an ulceration that has crusting on it, and this is the most common presentation of squamous cell. Although sometimes you can get larger lesions like this that really, some basal cell cancers can present like this as opposed to the round spot, and some squamous cells too. So in some cases you really can't tell. They can be similar in how they look clinically. Then we have to move on to do a biopsy to confirm what it is.
So none of these look terribly horrible like the sore does and the brown patch does, but you do have to kind of be vigilant looking at your skin looking for these.
Yes, indeed. And there are some symptoms that go along with these too. Usually the basal cell, we don't see a lot of symptoms. Oftentimes people don't even know they're there. The squamous cancer oftentimes is tender. When you touch it, it can bleed when you rub over it. So you tend to have a little more symptoms with the squamous cell cancer.
How do you diagnose it?
Well, two ways. First is a skin exam. And this can be performed kind of as you mentioned by patients themselves. They can look over their skin periodically, maybe once a month, and look for some of the types of lesions we just talked about and changes in their skin. And the second is exam by a physician or a dermatologist who are very knowledgeable in what these lesions look like and can diagnose them. Although once we feel that the lesion is cancerous, we do a skin biopsy, which is taking a sample of the lesion and sending it into pathology to confirm, first of all, that it is a skin cancer, and second of all, what type of skin cancer it is.
And you do want to get treatment for these types of cancer.
Absolutely, absolutely.
And what would that treatment be?
Well, the treatment is pretty similar for both types of cancers. One thing to note is that the basal cell cancer is the least aggressive form of skin cancer. It usually does not spread throughout the body. It just kind of keeps growing locally in its place. A squamous cell skin cancer does have a slight chance of spreading elsewhere in the body. It's not extremely high, but it is a cancer that has potential to spread through other areas of the body. The main treatment is excision, removal of the lesion, and there are various ways to do that depending on the size and location. Oftentimes, if it's a small lesion, it's easily accessible. We take it off in the office. We just remove it with a blade, take a sharp instrument called the curette, and scrape to make sure all the cancer cells are gone and cauterize it. We can also excise it where we remove it completely through the skin and put some sutures in. The tissue is then sent to pathology to make sure that the edges are clear. If it's a more complicated lesion or a recurrent lesion, there is a type of surgery called Mohs surgery. And this is a surgery where the cancer surgeon goes in and removes what he feels clinically is the skin cancer, and he maps out the edges and checks them right in the clinic as the patient is waiting. And if there's an area that still shows a little cancer, he then brings the patient back to the operating table and will take just that area of skin that was positive and then check that again. And the idea with Mohs surgery is to take only as much tissue as you need to completely remove the cancer. It's a very, very effective means of treatment for certain types of basal and squamous cell cancers.
If you have basal or squamous cell, once it's gone, or do you have to keep coming back in for checkups?
Well, generally, In most cases, it is gone forever, but there's always a chance of recurrence, even though that's slight. So we do want to see the patients back to periodically monitor the excision site to make sure it's not coming back. And the other reason is that once you've had a diagnosis of skin cancer, your risk to develop further cancers or future cancers increases. So not only do we review the site that we took the cancer off of, we also make sure we examine the rest of the skin to make sure there's nothing that looks suspicious. And in the case of squamous cell cancer and also melanoma, we do a lymph node exam to make sure there's no evidence of it having spread from the skin into the lymph nodes.
We're going to take a break, then we're going to come back and talk about melanoma.
Very good.